If you or someone you love has cancer, you've probably asked this question more than once. Is there anything I can eat to help my body? The internet is full of confusing advice. Miracle diets, forbidden foods, extreme fasting plans, and most of it creates more fear than clarity. But here is the truth. Food alone does not cure cancer, and no responsible doctor will ever tell you that it does. However, decades of research show that chronic inflammation plays a major role in cancer progression, treatment side effects, fatigue, and quality of life. And that's where an anti-inflammatory diet becomes important, not as a cure, but as a supportive tool that may help the body tolerate treatment better, reduce inflammation, and improve overall well-being. In this video, we will calmly and scientifically explain what an anti-inflammatory diet is, how inflammation affects cancer, which foods are supported by research, which foods may increase inflammation, and how cancer patients can approach nutrition safely and responsibly. What is inflammation and why does it matter in cancer? Inflammation is a natural and essential process in the body. When you cut your finger or get an infection, inflammation helps protect and heal you. But chronic inflammation that stays active for months or years, is very different. Long-term inflammation can damage healthy cells, DNA, and tissues, creating an environment where cancer is more likely to develop and progress. Scientific studies have shown that chronic inflammation is involved in tumor growth, cancer, cell survival, angiogenesis, which is the formation of new blood vessels that feed tumors, increased fatigue and pain, poorer response to certain treatments. This does not mean inflammation causes all cancers, but it is a recognized contributor in many types, including breast, colon, lung, pancreatic, and prostate cancer. Can diet influence inflammation? Yes. Diet is one of the most studied lifestyle factors linked to inflammation. Large population studies consistently show that certain dietary patterns are associated with lower inflammatory markers, such as C-reactive protein, CRP, interleukin-6, IL-6, and tumor necrosis factor, alpha, TNF-A. An anti-inflammatory diet focuses on whole, minimally processed foods, natural antioxidants, healthy fats, fiber-rich plant foods. It does not mean perfection, restriction, or starvation, and it does not mean eliminating entire food groups without medical guidance. Important clarification for cancer patients. Before we go further, this must be said clearly and responsibly. An anti-inflammatory diet does not replace chemotherapy, radiation, surgery, or targeted therapy, does not kill cancer on its own, is not a miracle cure. What it can do: support the body during treatment, help manage inflammation-related symptoms, improve energy and digestion for some patients, contribute to overall metabolic and immune health. Always discuss dietary changes with your oncologist, a registered dietitian experienced in oncology. The core principles of an anti-inflammatory diet. Rather than focusing on single superfoods, research shows that dietary patterns matter more than individual foods. Anti-inflammatory diets share common features: high intake of vegetables and fruits, emphasis on healthy fats, moderate, high-quality protein, low intake of ultra-processed foods, reduced refined sugars. Examples of dietary patterns often studied include the Mediterranean diet plant, forward diets, traditional whole food diets, key anti-inflammatory foods, supported by science. 1. Vegetables, the foundation. Vegetables are rich in phytochemicals, fiber, vitamins and minerals, antioxidants. Cruciferous vegetables, such as broccoli, cauliflower, Brussels, sprouts, kale, contain compounds like sulforaphane, which has been studied for its role in cellular defense mechanisms. Colorful vegetables like carrots, sweet potatoes, bell peppers, provide carotenoids, which are associated with lower inflammatory markers. 2. Fruits. Natural antioxidants. Whole fruits provide polyphenols, vitamin C, fiber berries, in particular, blueberries, strawberries, raspberries, are among the most studied fruits for their anti-inflammatory and antioxidant properties. Whole fruit is preferred over juice to avoid blood sugar spikes. 3. Healthy fats, reducing inflammatory signals. Not all fats are equal. Research consistently shows that omega-3 fatty acids are associated with reduced inflammation. Sources include fatty fish like salmon, sardines, and mackerel walnuts, flax seeds, chia seeds, extra virgin olive oil, a staple of the Mediterranean diet, contains oleocanthal, a compound with anti-inflammatory activity similar to mild NSAIDs. 4. Whole grains and fiber plays an important role in gut health, immune regulation, inflammation control. Whole grains such as oats, brown rice, quinoa, barley support beneficial gut bacteria which influence inflammation through the gut immune axis. 5. Lean and plant-based proteins. Protein needs may increase during cancer treatment, but quality matters. Anti-inflammatory protein sources include fish beans and lentils, tofu and tempeh nuts and seeds, eggs, in moderation. Red and processed meats are generally associated with higher inflammatory markers when consumed frequently. 6. Herbs and spices. Herbs and spices add flavor while providing bioactive compounds. Turmeric contains curcumin, which has been widely studied for its anti-inflammatory effects. Ginger, garlic, cinnamon, and rosemary also show anti-inflammatory properties in research settings. These should be used as part of food, not high-dose supplements without medical supervision. Foods that may promote inflammation. An anti-inflammatory diet is not about fear, but about awareness. Foods associated with higher inflammation, when consumed frequently, include ultra-processed foods, refined sugars and sweetened beverages, trans fats, highly refined carbohydrates, processed meats. These foods can increase blood sugar spikes, disrupt gut microbiota, increase inflammatory signaling. Moderation is key, especially during treatment when appetite and tolerance may vary. What about sugar and cancer? This is one of the most misunderstood topics. All cells, including healthy cells, use glucose for energy. Cancer cells do consume glucose, but eliminating sugar does not starve cancer without also harming the body. The real concern is excess refined sugar, chronic high blood sugar, insulin resistance. A balanced approach focuses on stable blood sugar, not complete elimination. Anti-inflammatory diet. During chemotherapy, cancer treatments can affect taste, appetite, digestion, energy levels. During treatment, nutrition goals may shift toward maintaining weight, preventing malnutrition, supporting recovery. In some cases, calorie-dense foods may be more important than strict anti-inflammatory rules. Flexibility is essential. A careful discussion. Intermittent fasting is being studied in cancer research, but it is not appropriate for everyone. Potential concerns include weight loss, muscle loss, fatigue, nutrient deficiencies. Some studies explore fasting under medical supervision, but it should never be self-prescribed during treatment. For many patients, consistent nourishment is safer and more supportive. The role of the gut microbiome. Emerging research shows that gut bacteria influence inflammation, immune response treatment, outcomes. An anti-inflammatory diet supports microbiome diversity through fiber-fermented foods like yogurt or kefir, if tolerated. Plant diversity. This is an exciting area of ongoing research. Breast cancer and inflammation. Breast cancer is the most common cancer in women worldwide. Research suggests that inflammation, obesity, and insulin resistance may influence outcomes in some breast cancer subtypes. Dietary patterns rich in vegetables, healthy fats, fiber have been associated with improved metabolic health and lower inflammation, important factors for many women navigating breast cancer treatment or survivorship. Mental health, food, and inflammation. Chronic stress can increase inflammatory markers. Nutrition interacts with mental health through blood sugar stability, gut-brain signaling, nutrient availability. An anti-inflammatory diet is not just physical. It can support emotional well-being as part of a broader care plan. What this diet is not. It is not a punishment, a rigid rulebook, a replacement for treatment, a guarantee. It is a supportive strategy, flexible, individualized, grounded in science, a message of realistic hope. We are living in an era of incredible progress in cancer care. Precision medicine, targeted therapies, improved supportive care. Nutrition is one piece of a much larger picture, but it is a piece patients can engage with every day in a way that supports dignity and quality of life. If this video helped you better understand how an anti-inflammatory diet fits into cancer care, please consider subscribing to this channel. Here, we focus on science-based, respectful, and supportive content for cancer patients, survivors, and caregivers, without fear-based messaging or false promises. You are not alone, and reliable information matters. Subscribe for more educational videos, expert insights, and calm guidance as you navigate this journey.